Portugal and the UK, in both countries, having strong physical activity promotion agendas, I guess. It's what we are responsible for. We are here today discussing some of the avenues for that. Two topics that I think are perhaps not as discussed in this context that I'd like to reflect on with you briefly are beyond governmental institutions, beyond academia, beyond even the private sector, which does what they do. Is there a role for grassroots organizations, civil society generated organizations that also contribute to this agenda? What's your view on that? And because personally, I think that's an underexplored resource, but it's a resource that has enormous intrinsic potential because of the motivation that typically is associated with these organizations and the capacity that they have to actually make the link between academics, government officials, and the public. Yeah. How do you see that in the UK?
When we developed, we developed in England, we developed a national framework about increasing population level physical activity because everybody active every day. And we spent a year looking at international evidence about what works to shift physical activity at population level. And one of the things that we did find was that actually the state can't do it on its own. Health professionals can't do it on their own. If you look at places such as Finland where we've actually seen population level shifts in a positive way in physical activity, it's been through grassroots organisations. It's about giving communities and individuals the support to develop their own ways that they want to be active, because everybody wants to be active in a different way. So and the state is not able to necessarily provide for everyone. And so it's actually what's critical and what we're trying to do in the UK after seeing what's happened in other countries is to actually try and support and encourage community-led interventions, because that's really where we actually start to see sustainable shifts in physical activity.
Are there examples that come to mind that have worked in whatever area it may be of physical activity that come to your mind as you think of exemplary or perhaps pioneering organizations that have already crossed that path, that bridge? And I can give you one that actually I think comes from the UK that has impressed me, that we haven't anything like that in Portugal. And here we are together with a group of friends that are particularly interested in developing walking programs and walking in the community. We'll talk about that in a second. But one of the projects that I found interesting is something called Park Run.
Yeah.
Well, you know more about it than I do. So, what's your take on it? And is that a good example for a grassroots association or an organization that promotes physical activity?
No, that was what I was going to mention. It's been incredibly successful in England, and what it is about is actually just giving individuals and communities the opportunity to come together to be physically active. So what's critical about it is that it's focused on fun, it's focused on communities, and it's focused on empowering individuals and communities. So you just sign up for Park Run, and then you turn up to where it's arranged, say at a weekend on a Saturday morning, and then with other people you can do you do the Park Run, which is a set distance, but some people walk it, some people run it. So it's about giving people the opportunity to be active in the way that they want to be. Yeah. And so what's critical about these things, and what the state is not really able to do, is about understand, about fun and about social cohesion and bringing people together. Yeah. And we've seen that in a lot of the other examples. It's become very popular in England. There's another example called the Daily Mile, which is based in schools. It was started by a school teacher about just getting pupils to just be active for 15 minutes each morning. It's called Daily Mile. Over half of the students actually do a mile, but it's actually just about bringing people together, and it's done in a whole school environment. So it's done, although it's led by teachers, it's about using a community, a school community, to get them active together.
Yeah. And I think one of the things that Park Run folks told me when I talked to them is that it's free, and that people obviously are encouraged by the opportunity of it's not just free of cost, but it's also free of contingencies, free of lots of impositions or set rules. I mean, they have a few rules, but other than that, people feel that they are doing their run, they're doing their thing, which I thought was interesting, and it has picked up immensely. And actually, we have tried to have it come to Portugal, and they said no because we're too busy. we don't want this to be, an enterprise, a multinational endeavor. So they said at the time we cannot respond in a way that would guarantee that it works nicely. So we'll rather wait a little bit. So I guess that brings us nicely because running is a form of fast walking, if you'd like, and I guess walking could be described as the most accessible, the most democratic, because it's accessible to all, and it's typically free of cost. It crosses generations, it crosses fitness levels. You can do it almost everywhere, and it's also a way, even though it could be done everywhere. And I'm thinking of the ways in which I think walking to be so important, or why I think that. It's also a way to be in nature, which is something that I think human beings are increasingly deprived of and need. And so we're here with a group of people, a group of friends that are all about helping us, and I say us in positions of some decision making, to promote walking in the population. One of the things, because in this conference we are talking a lot about healthcare services and linking, and that's one of my priorities, working at the health ministry, to try to link the health services with community programs, community resources, professionals in the communities and so forth. But also, interestingly, I think we have some good examples of where the health services themselves adapt a little so that they can be more active communities in themselves. So something like Walk with the Dog is an idea, or I think it's an inspiration for zebra, as we say in Portugal, where we have healthcare providers, doctors in particular, but not only that, actually giving the example, being active patients, active doctors, and going through it together, I think has a unique flavor to it, because it's not that position of authority is lost, and people can share the experience and can talk about it. So the conversation about physical activity, I think, becomes so much easier. Is that something that rings a bell from the UK experience as well, having the healthcare services or walking programs? Perhaps you have other walking programs that you want to share with us that are inspiration also to us as we begin this journey.
Yeah, no, the UK Chief Medical Officers, when they wrote their guidance in 2011 on physical activity, were quite clear that actually walking and cycling are the easiest ways for most people to get physically active, and also are the easiest ways to incorporate physical activity into your everyday life, because we know that you have to try and be active every day to gain the greatest health benefits. And so in England, there's a range of different people, both in terms of the healthcare sector, but also in terms of other sectors, and trying to support people and encourage people to walk. So the benefits of walking are obviously the general benefits of physical activity, but we also know the additional benefits of being active outside. So particularly walking, such as social inclusion. These things are very important for any individual, but in particular people who may have health issues or other issues that mean they may be socially excluded, so they may not be integrated into their community and have as many social interactions as normally. So there's a very good scheme, for example, in the UK called Walking for Health, and so it's free to people to use. So it's run by walk leaders. So you go and you just join the walk, and you walk as a group. So it's about physical activity, but it's also about doing activity as a group, which we know for a lot, not everyone, but for a lot of people, that's very important. And so we're also seeing in the UK a lot of things linking up. So some of the walking from health schemes are often start at a healthcare facility, like a doctor's surgery. And we're even seeing some doctors actually taking, as you mentioned, that role model in that leadership role and other healthcare professionals like nurses, and actually going on the walks as well. So certainly, you know, from what I've heard about Zebra, it sounds like, you know, very promising opportunity.
Yeah, good. And I guess walking is also an opportunity for inactive people to give the first step, literally, to enter physical activity, because it's so easy and everybody knows how to do it. So so we look forward to walk this talk and have physical activity be more and more a reality, a normative reality in our countries, and we hope to connect with many other organizations such as Zebra to help us do that. So thanks, Mike, for welcome to Portugal again, and we're glad to have you here and to hear what you have to say.